Hello, this is Dr. Shirley Canniff here, and I'm here with my husband, Dr. Jeffrey Canniff. And we are going to, right now, we're in the season of Advent, and I'm also completing some of my coursework over to Tufts University Medical School in the public health arena, specifically pain management and research. I hope I got that right. Yeah, pain management and research, the MS. The Masters of Science in that. And I have my husband here because I oftentimes, with his permission, have talked to, or, I actually interviewed him in a radio interview on Bar Talk Radio, doing a narrative, in the format of a narrative. And he really got a lot out of that. He understood about the nature of his pain and what he was doing, and what he could do better, and things like that. And at the same time, I was able to improve on my interview skills. Okay, so he's here to give a video presentation of what of his journey, right? Of your journey. I want to put a positive spin on this journey towards wellness from when he was 4, when he was first diagnosed with epilepsy, and the different tracks that this took and meant for him. And I just want to I'm going to stop talking right now, and I'm just going to ask Jeff, would you like to share with the viewing audience about your journey, and starting from when you were first diagnosed with epilepsy up until now with the leukemia and the issues with pain and things like that. And take it away.
Good evening, and thank you, Shirley.
You're welcome. Oh, thank you. Oh, thanks. Thank you. All right.
And well, my name is Jeffrey Canniff. Dr. Shirley and I have been married for 13, soon to be 14 wonderful years.
On Valentine's Day.
On Valentine's Day. And my history starts when I was born into a family in 1959, and that family became a family of 10 by 1976. And I was the second oldest, and I like to tease myself by calling myself my older sister was the prototype female of my parents.
And you're the prototype male. Okay. I heard, you can tell that I've heard this before. Okay.
And but it was just a matter, I wouldn't have traded the number of kids in my family or anything, because we did have a wonderful family life, and it kind of changed a little bit, but not badly. When I was 4, I started having seizures. I don't know what my mother's experience of that was, but I can assure at the time she was also, what was a blessing is that she was an EEG technician. So she was fully aware of what seizures were and what they looked like, because she was working with people who had the problem. So when I started having the problem, she knew exactly what to do, where to take me, and all that kind of stuff. So she was very blessed by God to have had a job in her pre-marriage life that trained her to understand seizures.
So Jeff, the thought that occurred to me when you were saying that you brought in your mother, but did you think it was a problem when you first had these seizures at 4?
No. It was only after I entered elementary school when other people started observing the behavior. Children started observing the behavior.
What were they observing?
Possibly pedometal seizures, inconsistency in talking in a conversation and stuff like that. But then there was one major Foxborough teacher who kind of made a public comment on it.
I mean, did you have any seizure-like behavior that maybe they were very concerned about, or was it something that the teacher didn't say anything? Would the students have used that as fodder for ridicule?
They used it anyway.
They did?
Yeah. Okay. It's just the nature of being a child, thinking you know everything, but you really don't.
Right. And they did this when you were in kindergarten or when you got older? Was it when you were much older? 7 years old?
No, I forget. First or second grade.
Okay.
All I remember is
6 or 7.
all I remember was my response was one of trauma and terror.
Yeah, right.
And it was never the same thing.
Like what each day when you went to school, you were like, oh no, what are they gonna say to me now?
Mm-hmm.
Right, yeah.
And it was a 5-minute, 10-minute walk at the most, and it took me 15 or 20 to get there because I was disassociating.
Yeah. Wow. So, no. So now we're in. We've started the journey at 4, and now we're full fledged into adulthood, and on the other side of your life in over 50. And so, what's significant? First of all, what other signals was your body telling you that other things were going on along, over and above the seizure activity?
Well, I just recently connected something that was happening when it was in the early 90s, like in the 80s. I was trying to go to college and work at the same time.
Okay.
And I'd work a 7 to 8 hour shift on the day I'm going to a 4-hour intense evening class. And I couldn't make sense of why I didn't have the energy.
Okay.
And that was like a first very clear indication of something out of place. Right. And then I just stopped going to school, night school.
Oh. Okay. And were you working at night and going to school at night, or?
Well, I arranged my but I arranged my schedule so it would be daytime shift and night off of the school.
Okay.
But what was it? And then after that, there was episodes were frequent.
Okay, so the episodes of what were frequent?
The pedomeal seizures.
Okay. Like what would happen? Would you be blacking out, or would you stop in the middle of something?
Not always, but like one of I think the manifestations of it was I couldn't see well in dark areas, where before I could see pretty well without having to worry much when I was younger. But this is a change I noticed.
Now doctors were telling you that you would outgrow this, and did the thought ever occur to you? I'm an adult male now, and why am I not growing out? Why have I not grown out of the seizures? Well, how could this? I mean, did that thought ever occur to you?
Frankly, no.
Really? Okay.
No.
Well, what other things were going on? You had, when we started
in that same space of time.
Yeah.
There was the bleeding nose issue. It was just at its very beginning. It looked like it was just your typical bleeding nose. Nobody even questioned that it might be blood. And I remember since then reading.
What do you mean? It might be blood? I mean, it was bleeding.
Blood,
no. You mean blood issue?
Blood. Like the problem is in the blood.
The problem is in the blood. Okay.
Not just the fact that I was
There's
bleeding.
a bleeding nose, right?
But that the problem was actually in the chemistry of the blood and the structure of the blood. And that didn't happen often, so it wasn't caught on as a symptom. And
I mean, like how many times did you have the bloody nose per year? I mean, how many? What?
I really.
Okay.
Well, it only intensified towards the when I had the blood diagnosed and treated, because I was more clearly symptomatic when that happened.
Right, but when we first started dating, right? I think that because you were single, you didn't have somebody to measure these things out.
Exactly.
And so when we started dating and courtshiping, what I noticed is that you had bloody noses a couple of times per month, and I was thinking, what's going on? And then it went to every other day, and then the sweating and all these other things, and the flus that wouldn't go away, and I'm thinking, and the other infections, and And I'm thinking, does he know that this is like not normal?
Mm-hmm.
So evidently, because of the epilepsy when you were
Well,
younger, and now
yeah,
you didn't know really what was normal for you.
right.
Mm-hmm.
And one other thing that I discovered was that there was a simple blood test that would have pointed them. There was
Okay, it was a simple blood
there was
test.
a simple blood test that I would eventually prove my diagnosis of leukemia.
Mm-hmm.
And the most inexpensive test, the last thing any doctor thought to do, except for one who was a very wonderful, intuitive, well-knowing doctor, and he was kind of doctor you don't want to let go of. And he, that's a whole story that will develop in a minute.
Well, he was the internist with Dr. Emma.
And
yeah.
And so just these signs and symptoms showing up, but not being put together, even
at different times.
Another problem that ran in the family was depression, and anxiety was another one, and both of those issues weren't very well diagnosed to me, and so they walked along with these bloody noses too, and it was just a matter of time.
And nobody knew that they were part of the syndrome of CML leukemia, which we'll talk more about.
Yeah,
in the next couple of minutes.
In its very early stages, it's just a mild effect on the blood, but it has major changes. Depression, what seems like a sudden rash that just grows until it's all over your body. Some other things I can't recall.
Because of the uric
increase of the blood
uremia.
acids.
You had uremia. Well, we kind of go ramble on and on and on, but this is what we're
2009.
Yeah. So it's in 2009.
2008 actually.
2008. Something I suspected all along, that my husband has a blood issue, but because I wasn't a medical doctor and I was his wife, I really had to walk very, very softly with my suspicions, and encourage him to see a doctor, because at one point he wasn't seeing. You weren't, getting in a car and going to a doctor's when these symptoms are coming up, because like any male, American male, white American male, you just didn't think that you didn't even think about going to the doctors. It was just the furthest thing from your mind. Something that you put up with, right? Yeah. And so when I was trying to tell him, look, this is not normal. We had a couple of discussions, I'm just being nice, and these weren't, it turned out to be not nice discussions. Heated discussions, okay, about why I think that he should go to the doctors, and things like that, because I was very concerned that when, I was seeing him deteriorate as time went on, but he didn't like this particular doctor as one of my doctors that I go to. When I was driving a bus, we always had to go to this particular doctor to do a general checkup on us, and so he can clear us to drive a bus. But he and Jeff took a liking to one another, and so Dr. Emma, decided that he'd like to take him on and find and do a series of blood tests on him. And there was a time span where he didn't see Jeff for 2 years, because Jeff, again, he took a little vacation from the doctors in between symptoms. And so this other doctor that we were going to, when I brought to, it was a female doctor, when I brought all the symptoms to Jeff, that Jeff was going through, to this doctor, she basically watered it down and
pulled rank on
me, and also, even though I'm Dr. Shirley, I'm not a medical doctor. I have a doctorate in divinity, and so she was saying, well, who's the doctor and who's the patient? Because it was something that she was treating a boil on Jeff's back. Jeff would get these boils occasionally because his body was trying to release something from his blood, from the interior, and that's what, as a person in traditional Chinese medicine, when we see that, we think there's heat in the body, there's pathogens in the body, and these things are trying to leave the body. So having a rash is a good thing that the body does um, to get rid of the toxins that are in the system. So this is what was going on with Jeff. And so I just, put a bug in her ear, and I said, well, don't you think he should have a CBC? That's what I guess that it wasn't the right time. He didn't have the right insurance to have so many CBCs, a whole lot of things. And so then after that, Jeff started increasing with his bloody noses. Things started coming through his nose that I haven't seen come through any other nose,
Mm-hmm.
right? And so it was apparent that there was a list of symptoms that were happening that I felt was, attributed to what's going on in the blood. And so right around January 9th, I was praying, and I was at church, and I felt God was speaking to me as a result of prayer and communion that there's something going on with my husband. But I didn't want to approach my husband because I didn't want to make him scared about what may be going on with him. And so my prayer was talk to him, put it in his heart to go to the doctor, check these things out, because I do not want to nag my husband. So, yeah.
And this was on the Sunday following this event of Shirley's. I was sitting down.
And you had a flu for about a good 30 days. You had a flu for too long.
Being quiet.
Mm-hmm.
And all of a sudden, it was like I just got up and went into the bedroom, was by myself. I have this fabulous picture of Jesus, and I was just captivated by it. So what I did was I got on top of my Queen Anne's bed, and I knelt on the bed, and I said a prayer. And in the context of that prayer, I was acknowledging that I was seriously ill, didn't know what it was, couldn't do anything with it. And as an act of surrender to God, I just went flat on my face on the bed. And I don't know how long I stayed there, but when I stood up, I unexpectedly felt these big arms come around from my backside to my front and pull me towards the person. And that person was the Lord Jesus Christ. And in that moment, he said to me, I am with you. And it was such a consolation in that moment.
And you called me. I was on the other side of the room.
Then
the other side of the house.
then I eventually, the next day, Monday.
Well, let's give them the rundown.
What did I miss?
Yeah, so you called me and you told me your experience, right? Mm-hmm. And then I said to myself, Jesus, should I tell him what I prayed the night before at church and what I saw, what God spoke to me in my mind in a visionary form about what's going on, what's really going on with him. Because basically it was like, if he doesn't go, the message I got was, if he doesn't go to the doctors, he's going to be a dead man in 2 weeks. Jeff had dropped 40 pounds, 50 pounds in 1 month without dieting. I was actually the one that was watching my weight and on the diet. And we were sharing food. I was cutting everything in half, and I was giving him my portions. And I was like, I had lost at the time 5 pounds. And I'm like, well,
for that period of time,
yeah.
I was.
And he was still hungry. He was eating.
What was going on is my body.
Weight.
What was going on is my body was trying to heal itself, and what was happening is that in that process, I didn't fully understand what it was until later. But in that process, my body was trying to heal itself, and it was increasingly need of more and more food energy. So I couldn't eat enough to satisfy the demand. So my body took the fat and took the fat. and I dropped it in like maybe a little less than a month. Because I started recognizing I was lost a lot of weight maybe 3 weeks into the month, so I've been a little bit sooner.
So then he, along with that, he was always reeking of urine without having an accident, and when he was sleeping, and I'm like, what's going on? And I was always smelling it on his
Very
skin.
profusely sweating at night.
And so what happened was his body, he was so toxic and septic. He had uremia, and it was very apparent.
For anybody who might not know exactly what uremia is, it's a byproduct of remetabolizing the white blood cells by the body. All the blood cells have ages, white blood cells included, and there were just too many of them. They were living too long, and that's why the numbers went up. And the body, but there was a phagocytic process trying to take care of it, and it releases the uric acid. So there was so much of that process going on that my blood was toxic.
Right, and so the test question, how we got him to the doctors, because I think we're leaving the cliffhanger. How did you get to the doctors? How did Jeff, get it into his mind and heart that he needed
as we dialogued
to go to the doctors?
Was the main part of this dialogue.
And so, I didn't want it to be me, and I wanted it to be him. And so he said there's something seriously wrong with him, and I said, well, God was already speaking to me as I was praying, and then I said, well, if this is indeed God talking to you and talking to me and giving you this experience, let's just put him to the test and ask these questions. Some people say putting a fleece out, and it comes from the Old Testament, where Gideon, was also having that faith crisis where God was talking to him about something. He goes, if this is you, I'm going to put this fleece out and, let the dew come, and I know it's you.
The second time
around.
Let the dew fall around it.
Let the dew fall around it and stay dry. So anyways, we didn't have a fleece, but this was a fleece metaphorical. It was a metaphorical fleece. So the question was, if this is you, God, when we go to the doctors tomorrow, I'll let Dr. Emma say, oh, I haven't seen you in 2 years. What's going on? You lost a whole lot of weight. Let's do 2 blood tests. Let's test for sugar and cancer. And that's exactly, he said those exact words.
But by his visual diagnostics, he reduced it to cancer and severe diabetes.
Right.
And the blood test proved which one.
Right. So the next day after the visit.
Well, on Monday the office was busy,
so
they were closed for a personnel seminar or something like that, in-house seminar, and then so the appointment was for Tuesday, and so all this conversation happened on Tuesday. Then on Wednesday, Shirley and I are working.
Actually, it happened on Sunday. The conversation happened on Sunday.
Yeah, but I just brought them along to.
Oh, okay. To Tuesday. Okay.
And then the wonderful conversation my wife and I had with my doctor was on Tuesday. Then that lab work report came into him by way of phone call. And I remember my mother saying she worked in a doctor's office, and when doctors call you from their office, it's because the lab company might have called them directly because of the seriousness of what they're looking at. And he told me that the numbers were extremely high for the blood count, the white blood count, and everybody.
He told you it was cancer, and he says blood cancer, and to get to Brigham Women's Hospital quick into the emergency room.
But he explained the information he was looking at, and everybody has these numbers. Normal is between 5 and 10. When you get sick, they would go up higher.
You're talking about the white blood cells,
in general. And then my numbers, when the doctor called me with the lab report, was 165,000, which is very high risk toxicity to begin with.
Yeah, and
with the instructions to go to the emergency room at one of the Boston hospitals.
And the only thing that Jeff had going for him is he has a very strong constitution, someone with something that, with a blood count of 15,000, according to what this particular physician was saying, would, and this person ended up dying. He was wasted. He became emaciated and wasted away because I believe he had he had acute, he didn't have CML, he had ACL, something like that. And so, oh no, AML. He had, I think it was AML. Yeah, the acute one. And which it had, there's more of a radical way of, uh, working with that. But one of the things that I remember the doctor saying to you, Jeff, was that you have blood cancer, leukemia, but they don't know which one it was. They're gonna look at the marrow more. But they said that there's a good kind of leukemia and a bad kind of leukemia. And the good kind is, the kind that they
have recently,
genetic studies.
Yeah, in the last 10 to 20 years have developed drug therapies for them.
So then they, because the doctors kept coming in and looking at Jeff and thinking, why is he not in a coma with these numbers? They were very intrigued. And, Jeff was talking like he's talking out. It's probably a little bit more wiped out. And
I was actually hyper relaxed.
Yeah.
After I found out that what the problem was, after my spiritual experience at home over the weekend, knowing that I was in God's hands, I mean, even waiting to be thoroughly looked at before getting a room, I was just like glad to be there. If I went into any type of bodily crisis, I was in the best place to be, right in the emergency room. So I relaxed.
Yeah. So, and did you have any pain too? Was there any? You obviously you must have
the achy joints
because of the uremia.
Untreated uremia.
Yeah. So there was a whole lot of things that he was already experiencing, even with the pain, the chronic pain, that we had no clue as to why. I had a suspicion, but he stayed in the hospital. Jeff stayed in the hospital, and I did with him for 3 days. They ran all kinds of tests. They found out it was the good kind, CML leukemia, and Jeff consented to a research. He wanted to be part of a research, ongoing longitudinal research that they were conducting. Yeah.
And it was concerning the medication they were going to be giving me.
And that's Sprycel. And Sprycel it had some side effects, eventually, and they had to tweak that. But now, well, all along you've been having two kinds of pain: joint pain and neuropathic pain. You want to talk about that?
Yeah, but let's continue the story.
Okay, that we want to continue the story.
Yeah. So after 3 days, being treated in the hospital and having all this blood work done, and even donations to research, blood donations for research and stuff like that. They started me on one treatment, and it didn't show any signs of starting any positive effects. So then they put me on what my current medication is, Sprycel, which has its generic, also known as dasatinib. And it was
which has its side effects after a while.
Yeah. And so it was quite a while before any side effects showed up.
Well, the first one was pleural effusion. Right?
Yeah.
I got a chance to actually witness them doing a thoracic
centesis.
Yes, thoracentesis, yes. Thoracentesis. And it was amazing. I mean, all this fluid came out, and it was because of, the Sprycel caused pleural effusion. So that was the side effect. And one of the things about medications, you're about 6 of them, right? That, we talked about this in the pain management program, some of your classes, that they, there's a lot of drug interactions, and never mind in the pharmacodynamic that's associated with the way that, or pharmacokinetics, that the effect that the drug has on the body, and the effect that the body has on the drug, how it metabolizes it. So this is what was going on with Jeff. within the last couple of years. So they had to, cut down on some of the Sprycel. He still had this undergoing pain. We talked about this in the radio interview, the narrative. So Jeff, you about ready to say something?
No.
Oh, okay. Yeah. So we got a couple of things going on
One of my consistent pains was the right knee.
Okay.
Which was diagnosed as having
osteoarthritis. Yeah, on top of that. So the kinds of pains that Jeff has to watch out for.
This was even before the diagnosis.
Yeah. So the kind of things that Jeff has to watch out for is the pain related to osteoarthritis, the neuropathic pain. He didn't tell you about that, where it's probably related to the epilepsy, where there's a lot of nerve, a lot of tingling sensations coming from the fingertips and the toes, burning. On top of that, so you had some things you had to really, really discern. Like what's going on in my body, right? And this look of puzzlement, because I was puzzled too. I'm like, Jeff, you're an enigma, you're a mystery all at one. And I said, soon I'm sure that when you figure it out, you're going to be a happy man. And so, are you happier
much
for
happier,
finding it out? Okay, yeah. And so, we know you're in your 50s. I'm in my 50s. The body, it has this way of
speaking to
you as you're getting older, as you're progressing. But knowing, that you have now a medical plan that you have to follow, and they're going to look at your brain more, because we don't want you to have the big one, because they did an MRI, and they found out in the occipital area of Jeff's brain that there's
unusual electrical activity.
And he's supposed to have outgrown the seizures, according to
what the definition of onset
is. It from the early childhood? Yeah.
Like I've read this definition. Like if you sometimes people who start having seizures at the age of 4 will outgrow them. It's the complete sentence. It doesn't mean all of us.
Yeah.
So I'm in the percentage.
Right. And of course, with the pain, there's memory issues. So we don't know if his memory issues are coming from the pain or from the seizure. So he's going to have a 3-day sleep study. Long-term
video EEG monitoring.
And they're going to look at his brain in living color.
And they're going to coordinate what my body does while I'm awake, while I'm asleep. And so
because
my wife says there's a symptom where when I'm asleep, which means I could be either asleep or having a seizure, I get very spastic in the bed. And she's so lovingly said that oftentimes this has chased her out of the bed.
Well,
I'm just being
right. So, but here's the scoop with that. I'm drawing a blank. This is the 3-dayer is going to be a segue from the sleep study you had overnight, the overnight study, to find out if he has sleep apnea, and because of that, they found out he has sleep apnea. And and why are they doing the 3-day study? Because what did the neurologist say? What research is out there that is causing them to be concerned?
I don't recall.
50 or 50, you're over 50.
Oh,
okay.
When they did the apnea study,
yes,
they it was just a proposed thing that the director of the neurology clinic was reading, and she came in to discuss the appointment I had with the doctor who was in training at the clinic, and she said she saw a proposed suggested possibility for people who develop answering the question who would develop
seizures,
sleep apnea
and seizures,
and it said what was she said she saw the report and she saw that and she thought the information was possible. In my case, there's a possible link of sleep apnea here because the question's starting to come up in the research. The question, it's not an answered research response, but it's how, when
It's in
when you
progress.
get it
Yeah.
when you get a question, you
Mhm.
start spreading it out to people people would be interested in asking it.
Yeah.
And
Well,
so she approved me to have
well, she said there was research out
a
there
sleep study for it.
that the people that there have been known people that men over 50 that have had epilepsy and sleep apnea, that
No,
there's a correlation.
yeah,
It may be a correlation.
males over 50 who
Hmm.
have seizures could develop sleep apnea.
Yeah,
That was the question.
that was the question. So this is what they're going to try to find out. Is it that kind of seizure that So they want to avoid the big one, but so don't we all, right?
Mm-hmm.
He is very compliant with the seizure medications, but what's happening is that there's something his body's doing to the medication, and it looks like it's increased and it's supposed to be there, but then it stops. And they asked Jeff, are you compliant with your medications? And he is. He takes it all the time. So there is something to what his body's doing that is still causing something to be used up, and this medication is time released as well. So they're going to find all this out the first week of the year, 2017. So it's good, And I learned a lot about what's going on.
And from the description I have of this test, it's going to correlate the brain activity and the body's activity, and so that they can do a really good comparison. It can be anywhere between 3 to 7 days long. So
they're going to find a lot about you, Jeff. A lot of things that you may not even know or be aware of. So that's going to be good. So what would you like to see? Knowing all this, what's going on, is there anything that you would like to see happen for you? For your life now. What things are important to you now? And what would you like to get out of this? What would you like to, you know, you got so much activity going on in your body and people responding to you, doctors, and trying to figure out what's going on. Is there anything that, in your life that you would like to do that, you haven't done, and you're.
One of my things is the passion for
writing. Okay.
And some other things are traveling to support that writing. Some places like some of the Catholic holy sites in France, Italy, Spain, Ireland,
and what would you like to write about?
Well, I have several different stories. I'm only going to tell you of my top one, which I'm going to dive right into. And it's called The Sword of Connemara. It's a very good story.
You just need to give a summary. We're almost at the end.
Okay.
Yeah.
It's about a family's legacy where people have to make a very difficult choice relating to their twin grandchildren, male, female, fraternal twin grandchildren, and how to help them preserve their lives from something that's coming against this family. And process is a group of Catholic people who get somehow transported to Ireland and meet up with the grandparents, and so they're a source of prayer, and they meet members of the family as they make the decision for their course of action, and
that will affect the rest of their life and the generations.
Affect the children, the twins, and it really ends up being a testament to being a faithful Catholic believer.
And also like the role that grandparents play in the family and helping making decisions when there's crisis involved, whether it be unplanned pregnancy or any of the social ills of society, right? And this takes place, what, in the 1950s, right? And then it goes into
Really don't have a time frame yet.
Oh, you
but,
don't? Okay.
Yeah.
Oh, I
I have
thought
to
that's what we talked about. So
No, I have to calculate the ages of the
Okay.
people in the story.
Well, I'll let you
the
write the
time
story and
frame
develop. Now you
to-
have all this time,
to
right?
develop the time frame of it.
Yeah. One thing about me being his wife is like we after being married for 14 years, you start thinking like the other, and at the same time you're thinking, oh, maybe I should, not step on his toes, or maybe I should, continue to give him the space to create, and anytime he wants to talk to me, I'll just give him some suggestions, whether he wants the suggestions or not. Well, anyways, on that note, if we're heading into the holiday season and we're in Advent, and we just wanted to say Happy Advent and Merry Christmas and Happy Hanukkah and Happy New Year.
And may the coming of Jesus be a year full of blessing for you.
Whether you're Catholic or non-Catholic, it's just blessings. We can all receive that, right? Right. So,
my God isn't cheap. He loves. He's a generous giver, and I want to be just like him.
Okay. All right. It was great being in this class. And Pam, feel free to use this testimony of Jeff's life and as a case study. Is that all right, Jeff?
I hereby grant permission that this conversation and my picture can be used in any educational means you see appropriate to help instruct your students.
Okay. All right. Thank you.